What is egg freezing? Egg freezing has been there since the 1980s. It is a procedure which represents an investment not just of money but also time and emotion. We know that fertility of a woman declines with age, and as more and more women are getting married later on in life, maybe to pursue their career goals or for other reasons, when they get married, they have a problem in conceiving. The number and the quality of eggs in a woman's ovaries declines after the age of 35 years. And between 38 to 40 years, there is a very steep decline. So, when a woman gets married later on in life, she has a problem in conceiving. However, if she opts for freezing her eggs when she is in her early 30s, or better still, when she is in her late 20s, then when she gets married at a later stage, she can utilize these frozen eggs and get pregnant. This is known as social egg freezing. There is something known as medical condition for freezing of eggs. So those ladies who are undergoing chemotherapy or radiotherapy for cancer, it might affect the ovarian reserve, and in such conditions they freeze their eggs before the start of treatment so that after the treatment the frozen eggs can be utilized for conceiving. What is the procedure of egg freezing? The procedure of egg freezing is relatively simple. It involves a series of hormonal injections which are given over a period of 10 days. Once the eggs are mature, then the lady is given a short general anesthesia for 5 to 10 minutes, and all the oocytes or eggs are retrieved. These are then frozen in liquid nitrogen at minus 196 degrees Celsius, and they can be frozen with the lab safely till she decides to thaw them. So at a later stage, when she gets married and wants to attain a pregnancy, these eggs can be thawed. They can be mixed with the husband's sperm to form embryos, which are then put back into her womb by the process of embryo transfer, and she can conceive. What is the fertility timeline? Every lady has her own fertility timeline. There are ladies who may have a problem at conceiving when they are 22, and there are others who conceive naturally when they are 44. So there are a few factors which affect the fertility status of a woman. In order to assess the fertility status of a lady, we do a basic ultrasound to see the ovarian reserve, and there are some blood tests like the AMH. We also study the family tree because that also affects the genetic traits which influence her fertility. Is everyone freezing their eggs? With several corporates covering the cost of egg freezing, the process has officially gone mainstream. So all the ladies who plan to pursue their career goals and perhaps may get married later on in life have the option of freezing their eggs when they are young. It is projected that nearly 76,000 females would be freezing their eggs in the year 2018. Egg freezing is a simple technique which gives the liberty to the woman to freeze her eggs when the number and the quality are good, and conceive at a later stage in life utilizing her own eggs, which increases the chances of pregnancy.